Now, on this side of it, how do you respond when younger physicians come to you and say, I'm thinking about opening my own practice?
I 100% say go for it. I tell them it's going to be hard. It's never an easy day. You're wearing all the hats, but it's so worthwhile because you're practicing the way you want. You're making your own schedule, especially now having kids. It's so nice to be able to make my own hours, go to the soccer game, go to gymnastics, go to dance. I tell them to go for it. I tell them to absolutely go for it. Don't listen to all the negativity. There's so much positivity out there too. There's so many successful practices out there, and it's just a matter of wanting it and being willing to put in the hard work.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel.
Hello and welcome to the Pinnacle Prescription Podcast. I'm your host for today's episode. I'm Dr. Natalie Crawford, and today I am joined by Dr. Lilly Khavari for Shifting Your Path, Leaving the Employed Model. Lilly, we're so excited to have you here today, and I'm going to brag on you for a minute before I let you talk and just read off a little bit about your bio. So you're a board-certified, surgically trained foot and ankle specialist, and you focus on pediatric and diabetic foot care, sports injuries, acute and chronic conditions of the foot, and you are owner of the Carrollton Foot Center in Carrollton, Texas. And I know you're really a prominent educator and national speaker. You're now on the board of the Texas Podiatric Medical Association and chair of the communications committee. So I know you're really interested in pediatrics, regenerative medicine, minimally invasive surgery, but also like patient education, awareness, and just a huge advocate for the people you care for. So that is exactly what Pinnacle's about, and we're so excited to have you here today.
Thank you so much, Natalie, for having me. It's truly such an honor. I listen to the podcast all the time, so I'm excited to be here as a guest this time. And yes, thanks for that introduction, and I'm happy to be here.
All right. Well, why don't you start by maybe giving us a little bit of insight into why you chose to go into podiatry and specialize in feet and ankle, because I know a lot of people in different areas of healthcare listen to this, including people who are maybe earlier in their journey and trying to decide what might be a good path forward for them.
So ever since I was a little girl, I knew I wanted to be a doctor. What kind of doctor? I had no idea, but I knew I wanted to be a doctor. That was definitely the path. I was never a math person. I was always into science and just learning about the human body. It was always so fascinating to me. When I was in undergrad at UTD, I was in a study group and everybody was on a different path. I was studying for a dental school exam. My dad is in the dental world, and so that's what I kind of grew up around.
Yeah.
And that was kind of what came natural to me. In the midst of it, I got introduced to someone who was married to a podiatrist, and so she kind of talked about podiatry to me. I had no idea what podiatry was. I had never heard of it. So I started shadowing him because it was intriguing. They were doing surgery, and that they got a little bit of kids and sports medicine. From everything that she said, it just sounded so interesting to me. So while I was studying, and it was my junior year, I started shadowing him. I kind of followed him in some surgeries, shadowed him. Of course, you can't scrub at that point, but just kind of seeing the day-to-day in his clinic and at the surgery center. I love that I was able to have like an 8 to 5 kind of job. You could kind of choose if you wanted to be the trauma surgeon who was on call all the time, you could take that path. But if you also wanted, for me, I knew I kind of wanted to have a family someday. But surgery, I never knew I would be into it until I started shadowing him. And surgery was just so fascinating to me. So I love that I could do surgery. I could do kids. I could see, middle-aged, kind of older geriatric patients, and at the same time have surgery and, be able to kind of make it what I want, and be able to have that kind of family life balance. Do it seem like it, at least at that point? So I completely changed paths and I started studying for the MCAT instead of the TATs, and it all
It's like
worked
one
out.
end of the body to the other, right?
Yes, completely. My parents always said that. They're like, you moved from one opposite to the other. So it's so true. And I did. And I got accepted to a couple of the different schools, and I chose Miami just because it's Miami. I mean, why not? And completely different path. And I haven't looked back since. So it's been great. It was a great decision.
So tell me the pathway, because I'm not as familiar. Like if somebody wanted to become a podiatrist, so you said you study for the MCAT, just like for medical school,
Absolutely.
apply in. How long is podiatry school?
So podiatry school is 4 years, just like the traditional medical school. The first 2 years, you're doing your basic sciences and your kind of in-class kind of training. And then the last 2 years, so third year is when you're doing your clinicals. And the fourth year, you're doing the externship. So you're picking out kind of where you possibly might want to do your residency, and you do a month at each of those programs as an extern, and you're kind of checking out the program, they're checking you out. So when residency interviews come around, it's one day. So I think our interviews are a little bit different. There's one national day where all the programs come to a central station.
That's brilliant.
Yes, and so it started with a day. Now it's a whole week. So we have the eastern kind of states, the western, and the kind of Midwest. And so all the students come, and it's been in Frisco for the past few years. I believe they're moving it to Chicago. But so yeah, you do all of your interviews, and then there's a match process. So you go through the match, and and then the whole scramble process. If you don't match, and then there's a 3-year residency program to wherever you end up matching, and in the residency it's standardized. Everybody gets trained in surgery, so it's so we have forefoot and rear foot. But when it comes to certification, you can kind of choose. You can get certified in both forefoot and rear foot, or if you just want one over the other, you can pick and choose where you want to be certified in. And you have an option of doing a fellowship. So fellowship would be in sports medicine or wound care. Those are usually a 1-year fellowship. So that's kind of the course of it. 4 years of undergrad, 4 years of podiatry school, 3 years of residency, and an optional fellowship.
So yeah, just as long, right? Just as long, just as hard. My husband's a pharmacist. And so as you were kind of talking, one thing that resonated with me is how sometimes people have this idea like, oh, that's an easier path to be a doctor, but really there's like not as many programs. It's so stinking competitive. Like I watched him do it, and I am imagining as you're talking about podiatry, it's probably similar, that there's not as many programs. So it's actually probably very competitive to try to get in, and this.
Yeah, so we obviously there's not as many podiatry school applicants than there is to the traditional medical school. There's been more and more lately. So they actually just opened a new podiatry school, and they call UTRGB. So it's in south of Texas, and so now we have a total of 8 podiatry schools in the country. So for a while there was a residency spot shortage, and so it was very competitive. There would be people that were waiting for the residency, but now I believe there's enough programs for applicants. So, but definitely the podiatry is definitely getting more and more known. More people are kind of learning about it, but also there's a great need of it with, the increasing diabetic population in our country. And, there's always motor vehicle accidents. There's a lot that we do as podiatry, and so there's definitely a great need of it. So it's a great career.
What is your favorite thing about being a podiatrist, or your favorite type of patient to take care of? What do you love the most?
So my favorite type of patient, I love the pediatrics for sure. That's definitely close and near to my heart. And they come in with like ingrown toenails or soccer injuries. My little dancers, they come in, they sprained their ankles, things like that. So that's definitely my most favorite. They heal really well. They're quick healers, right? So you definitely see results faster. I love one of my kind of my niche now is like minimally invasive surgery and just getting people back to normal as fast as we can. Traditional foot surgery, it's your foot, so you're off of it. You're using crutches, you're using scooters, you can't drive if it's your right foot. So there's a lot of kind of limitations with it. So a lot of people will put it off for a long time. But with minimally invasive, we're able to get them to walking the same day of surgery, or get them back to boot camps and running and things like that at 6 weeks versus 3 months. So that's definitely become my new kind of niche, and I love to keep learning about it and doing more and more. But yeah, I would say pediatrics is number one, and then doing minimally invasive surgery.
I am going to ask you just a few general foot health questions, and I'm an ovary expert, so this is like totally not my jam. So please treat me so novice. And I know the bulk, we're going to get into a lot about your career transition and starting to practice, but I just want some people to have some basic stuff that I'm always curious about, or my family, and you're the perfect person to help all of us be a little more educated. So let's do kids. Sprained ankle versus a broken ankle, right? So your kids playing sports and they come in and they have like a hurt ankle. When are we worried that it's broken? When are we worried that it's sprained? Is this we always need to get it x-rayed? Like, what is your best advice when it comes to, we'll say, the pre-puberty child?
So the biggest thing to look for in a sprained versus a broken, let's say, ankle is with a broken bone, it's really hard for them to immediately wait there. So if your kid stands up and falls right back down, the chance of something being broken is higher than just a sprain. With a sprained ankle, they get up, they may be limping, they may be complaining, but they're able to walk. It's not so bad that they want to, stop, or they want to be carried, or they fall back down. With a sprained tendon, ankle, anything like that, there's a lot of swelling. Sometimes there can be bruising, but lots and lots of swelling that goes down after about 72 hours. So if you're doing your rice therapy, you're resting it, you're icing it, you're wrapping it with some kind of a brace. The swelling is coming down, the pain is getting more tolerable. But if it's been 3-4 days and the swelling is not changing, the pain level is not changing, chances of it being broken again are higher, and that's when I would take them to get x-ray. So the 3-day rule, and then the basic, hey, can they stand up right away and walk, or do they stand up and kind of fall right back down?
Okay, I hadn't heard of some like the 3-day rule, so I think that's like helpful too, just to know like when is this starting to like fall off the curve of a little bit normal. All right, let's. What about plantar fasciitis? Like, what is that? Why do I hear about it? What do you do about it?
So that's probably the most common thing we see in the office. It's always like in the middle age. Honestly, I mean, I've seen teenagers have it, but it's very uncommon. Mostly middle age, so age 25 to 45 really is where we see it most. It's basically the tightness of the plantar fascia. So that's your posterior chain. So your Achilles tendon is attached to your plantar fascia. So if you're a person who loves to run, and I know, Natalie, you love to do your Peloton just like me. So, and a lot of times we're not spending enough time stretching. So being on your forefoot and your heel being off the ground, your Achilles is getting tight, your plantar fascia is getting tight. And a lot of times we don't wear shoes or sandals around the house. There's a lot of hardwood floors, or we work in places where there's hardwood floors, hard surfaces. So our heel bones are taking a lot of impact from the ground. And if the plantar fascia is tight, a lot of times when it's rubbing against that heel bone from the bottom of the foot, the tendon is getting inflamed. Sometimes if there is a heel spur, you're getting micro tears in the tendon. And so that becomes this inflammatory process. A lot of times it hurts more in the morning or after a while you've been sitting down, just because, you're not moving when you're obviously laying down or sleeping, and all of a sudden you stand up, your tight tendon gets caught on the heel bone, and that's that sharp pain. And a lot of people explain it as, oh, I'm walking like a 70-year-old until it kind of warms up, it stretches. So stretching becomes a really big thing. So I would say if you're a big athlete, you like to run, you like to do a lot of cardio type workouts, stretching before and after is a huge factor in preventing plantar fasciitis. Wearing decent arch supports in your shoes and you want to make sure that it's something that has some kind of a hard shell. There's a lot of, not to put down Dr. Scholl inserts or anything, but a lot of times those are more gel type. So they feel good for a day or two, but they're not correcting anything biomechanically. A lot of times, we're doing something we call pronation, where your arches are falling inwards as you're running. And so that puts a lot of pressure on the plantar fascia. So wearing some kind of a good arch support in your tennis shoes is really important. So lots of stretching, lots of, arch supports are kind of like glasses. I always tell people they're maintained, if you're good wearing glasses, you're reading well, you're seeing well, you have no problems. Same thing, arch supports are kind of prescription for your feet. Even if you don't have any problems, they're great prevention and knee arthritic changes as you get older, or ankle arthritis, hip joint problems, because they kind of line you up. Your foundation is getting straightened out. So if you're correcting it, then. But yeah, plantar fasciitis is definitely the most common thing because nobody stretches.
So, question on that: if you have plantar fasciitis, so you mentioned a bunch of things to prevent it, which obviously prevention's always going to be the best. But let's say you get it and you're trying to do more stretching and you're wearing your arch supports. Is there a certain type of, exercise or activity you should avoid doing till it gets better? Does it go away? Does it get better? Or
so it should go away. It takes about 6 weeks of you really treating it to go away. And that involves, like you mentioned, like the stretching, the arch supports. A lot of times we do a course of anti-inflammatories. So whether that's oral anti-inflammatories or topical, it can be anything, topical anti-inflammatory, CBD cream, arnica, anything that you can find that has anti-inflammatory effects. Sometimes if it's a little more aggressive and you've done that for about 2-3 weeks, but the pain isn't improving, then we suggest seeing a specialist, seeing a podiatrist. Sometimes you may need a steroid injection to kind of bring down the inflammation. I'm not a big believer in steroid injections. I think it helps with the pain, but definitely long-term effects. You don't want to be getting injections left and right. So there's a lot of better kind of treatment options now. There's regenerative medicine, there's PRP, there's MLS laser, which is a pain-free kind of anti-inflammatory class 4 laser that we can do that actually repairs the plantar fascia. So yes, it can be resolved and kind of go away for good. You still have to maintain it. Once you've had it and it's gone, it doesn't have to be, a recurrent condition as long as you're wearing decent shoes, decent arch supports. So again, kind of like the glasses analogy. As long as you're wearing it, you're doing okay. Same thing. You should be wearing arch supports in your shoes when you're walking. It's that 80-20 rule, right? 80% of the time, wear your good shoes, wear your arch supports. The other 20%, we're wearing dress shoes, heels, things like that. Of course, we all love that. Who doesn't? So yes, once it can go away and stay away. But yeah, it does have to be treated.
Okay. And I've got one last, we'll say, like podiatry specific question before we dive into some of your entrepreneur endeavors. All right, maybe controversial. Pedicures. What are your thoughts?
I think there's a safe way to do it. Hey, I love pedicures. I go get pedicures. You want to definitely find a place that you can trust and things that you want to check for. Of course, I think pretty much all salons are using sterilized instruments at this point and everything. I am a big fan of places that don't have the big massage chairs. They just have chairs with, the smaller buckets. And the issue there is the plumbing. A lot of times there's mold, bacteria, things like that in the plumbing. So that's one thing. If you can find a place like that, it's always, of course, recommended if you can take your own instruments. The biggest thing that almost none of my patients ever think about is taking your own nail polish. And the reason for that is, they may be using that polish on a customer that has had, I was about to say on a patient, and a customer that has had nail fungus, that's active. And so they paint their nails, they dip the brush right back into the polish. And then you may be the next person that brush is being used on. So that's an easy way for that fungus to transfer into your toenails. And that's something a lot of us don't think about. Another thing is don't shave your legs, your feet the day of when you're going to get a pedicure, just because when we're shaving, we're creating a lot of microcuts in the skin. And, again, with the plumbing of those massage chairs, any kind of a small bacteria, it's a lot easier for it to kind of cause any kind of a skin infection. So I would say if you're shaving, maybe wait a day or two before you go get your nail polish. But yeah, absolutely. As long as you're taking some precautions. And, another thing that I like to say is those grinder looking things that they like to use on the bottom of the foot to kind of get your calluses. Try to stay away from it. It feels really great for a day or two, but it takes such a thick layer of skin off that the body's response is to just replace it quickly, so the calluses come back a lot faster and a lot thicker.
Like the cheese grater looking
Yes,
thing.
the cheese grater. So stay away from that as much as you can. Have them use the pumice stone. They don't want to do it because it takes them, longer, and it's a little bit harder muscle work for them. But definitely safer to do that than the cheese grater. The cheese grater has those little crevices too that a lot of times they don't scrub very well to sterilize. So when there's a lot of skin particles in there that are not getting sanitized. So take your own polish, take your own instruments if you can, stay away from the big chairs, and don't shave the same day.
That's good. I haven't ever thought about the big chairs and the plumbing versus the places that essentially bring out like a fresh bowl, right? That makes so much sense.
Yes, absolutely. Yeah, there's a ton of research on it now. There's a lot of research that has been done, and it's amazing. I was dumbfounded too, honestly, when I read it. So, but it makes sense.
Bet it makes sense, and so I think we can all say we probably just overlook things we know are bad, or wrong, or bad hygiene potentially. But then when you get the skin infection or the bad thing, there's no excuse because we all know. So I think that it's important that we're talking about that.
Yes, absolutely.
Tell me how long you were an employee. Were you an employee first before you transitioned to opening your own practice?
So right out of residency, I joined a group practice. I was the fourth doctor that was added to that practice. I was like so excited to be starting a big group practice, lots of patients ready to go, but and I loved it. The first few months it was great. I got a lot of hands-on, surgery and everything, but it came to a point where I was realizing that I was practicing the way they wanted me to be practicing and kind of following their protocols. And, if I wanted to do a surgery and they were dictating me what kind of implants I should use, or kind of just telling me how to practice. And, I didn't say anything. Of course, you're a first-year associate. You just kind of listen to what your employer is saying and doing. But it was at that point where I was like, okay, I know this is not for me. I know at some point I have to make a change. I wasn't ready for it at that point. At the end of my first year, I ended up getting pregnant with my first kid. She's almost 9 now, but I went on my maternity leave, but after 3 weeks, they were calling me to go back. And so that was another thing. I was definitely not ready to go back. And so it was around week 5, I went back. There was somebody else sitting in my office when I went to the office. And and they were like, oh, well, she's here to help us. But I kind of got the gist of it. They didn't say, don't come back or anything, but I was just I was done with that. So I went and joined a different group practice. And that was kind of a good thing for me for a while because I was doing it part-time and, I had a baby, so that worked out great. But unfortunately, with both of these practices, and then as I learned, this seemed to be a common thing, at least in podiatry, where you start as an associate and you're given certain promises as, hey, this is your base salary, you're going to make a bonus, and, you're going to be partner in 3 years. So many promises that just were not kept. And, you see, and it's not all about money, but you see the income that you have and how much money you're making for the practice. And, and then there was a lot of, kind of blurred lines as to what was going on, with the billing and all of that. But the biggest thing for me was the culture. And, this wasn't the way I wanted to treat my patients. I kind of wanted to treat them the way I wanted. I wanted to spend more time with the patients and not be rushed. Okay, you need to see 30 patients to make this base amount of money to be able to make a bonus. So I needed to slow down. I like to really educate patients. I don't want to be in there for 5 minutes and say, hey, this is your diagnosis. This is what you need to do. I found that when patients understand what's going on with them, they're so much more kind of compliant, and they do what they need to be doing to get better. Whereas when you go in for a few minutes, give them a piece of paper and say, hey, this is your diagnosis, a lot of times they kind of fall off. Maybe they don't come back, or they come back and they're like, I'm not getting better. So I like to spend that time with the patients, and I couldn't do it when I was part of a big group.
So looking back, besides just wanting to practice medicine the way you want, which I think is reason enough itself, but were there, let's say, just red flags, whether it's at your first job, just saying, if I rewound, I would tell, younger Lilly to ask this or to be aware of this, or things that you maybe pushed under the rug that really were more representative about the practice as a whole?
Absolutely. There was a lot of kind of shady things going on with billing. We'll leave it as that. But just the way, certain procedures were being coded with the office visit, or, things that, should not be happening.
Yeah.
But, in your best judgment, you shouldn't be doing it, but that's how they're making money, and that's their practice. They want you to bill a certain way. And, so yes, absolutely. There were red flags like that if I was to go back, I probably would stand up, for it and say, hey, based on what I know, this is how it should be done. But a lot of times, we do a lot of DME, we call it durable medical equipment, right? And in podiatry, there's boots, there's diabetic shoes, there's crutches, all kinds of things. So with those, again, how the frequency of how much you can dispense these to the patients, and the dates that were being changed, just a lot of shady things that were going on that shouldn't be going on. Absolutely.
What was your biggest barrier to starting your own practice?
So it started as a very small kind of like this thought behind my head. I would love to do this at some point, but it was a lot of planning, right? Getting the business plan together. Where do I go to get loans? Where do you start? Do you buy a practice from someone who's retiring? Do you start from scratch? You hear so many things from everyone, and both of my old kind of bosses, I guess I should say, and they were both women, great women, smart business women. But sadly, they didn't watch out for their own, I say, right? So they were both like, especially the second one, when I started saying, hey, since this partnership thing is not working, I'm thinking about opening my own. There's a lot of negativity. Oh, you can't do it. Private practice is dead. You can't do it on your own. And that's the kind of the voice you start to hear. So for me, that was one of the biggest hurdles. You just hear all these negative things about how hard it is. And, the practices that are surviving are big group practices, or part of hospital groups that private practice doesn't survive. So that was one of the biggest things, but also not knowing where to start, not, having, the guidance or the group to say, hey, this is the steps you need to make. And so I reached out to we had this group in podiatry school called Practice Management. So I reached out to the guy who used to run it, who was the president of it. He became kind of my mentor. He was in his 60s. He had a practice in Jersey. And I called him one day. I was just so frustrated coming back from work. And I was like, I'm tired of working for other people. I'm thinking about this. What do you think? And he said, I think you need a good amount of savings. I think you need to go get a big loan and have a husband who's supportive of you and knows you're not going to make money for at least the first 2 years. But you should do it, and he was so positive about, how once you make it your own and you do, you're putting your passion into it, the private practice is not dead. It's when you start kind of doing, practicing the way that others are doing, or you're not spending time with your patients. When you're giving patients that attention and you're making it your own, the patients will come. And he was just so motivating, and he introduced me to someone who helped with practice startups. So she helped me put a business plan together, and told me, hey, go to these smaller banks. Don't go to the big Chase or Bank of America. They're not going to give you, a brand new doctor a giant loan to open a practice. So once I started getting some guidance, it just became kind of every step kind of cleared the next step, on the path. And so, but I would say not having enough guidance was definitely the worst thing. Just having to dig for it.
Right. There's all the things you learn all the time. None of it is actually the stuff that you need to really practice medicine the way you were taught, right? Because in today's medical society, like, you really have to, that's our experience. So I'm a completely different body part, right? But the same story at different employed jobs. And at the end of the day, I felt like we didn't go through this much training to not be able to take care of people the way I wanted to. Right. So you just have, my partner and I say, we jumped off the cliff. You just have to do it, because you're always going to be able to find 100 different reasons why this isn't the right time or why it won't work, but you got to bet on yourself.
Yes.
When did you open?
So this April was 6 years. So 2018. Mm-hmm.
Look at that. So
time flies when you're having fun.
Now on this side of it, how do you respond when younger physicians come to you and say, I'm thinking about opening my own practice?
Mm-hmm. I 100% say go for it. I tell them it's going to be hard. It's never an easy day. You're wearing all the hats, but it's so worthwhile because you're practicing the way you want. You're making your own schedule, especially now having kids. It's so nice to be able to make my own hours, go to the soccer game, go to gymnastics, go to dance. I tell them to go for it. I tell them to absolutely go for it. Don't listen to all the negativity. There's so much positivity out there too. There's so many successful practices out there, and it's just a matter of wanting it and being willing to put in the hard work. Yes, it's not going to be, and I tell them, what, be prepared. There may be a month you're not paying yourself. It's going to happen. There's good and bad. There's up and down. It's just part of the small business. Yeah, COVID is going to, my COVID came like a year and a half after I opened. So I was just starting to get busy, and it was like, whoop, here you go, COVID. And but I mean, it's so worthwhile. I encourage it. And I like to help guide them. I say, hey, I can send you my business plan. I can, I like to help people. And I think it's absolutely worth it. It's just, there's so much negativity out there that we just need to not listen to.
That is so true. Like, everybody else tells you why you can't do it. And I don't know if it's out of their own jealousy or insecurity or where it's coming from.
Yeah, I don't know either. And for me, it was mostly people who were, close to retirement, or people who had opened a practice. It takes hard work every day. You're working on marketing. Every day you're working on your practice. You can't, it's not like, okay, I'm good, I'm golden, I have patients all day, every day, and that's it, you stop. It's always evolving. So I feel like if you understand that and you have that in you, then you can absolutely survive and do it. But if you're someone who doesn't want to mess with that, who doesn't want to be marketing, who doesn't want to, talk about your practice all the time and, services you offer, then it's perhaps not for you. But if I think you have to have the right personality for it, for sure.
Agree. It definitely is like a way of life, not just a job. Mm-hmm. But I think it's so rewarding in so many ways, because you really do get to control the full experience. And if you're going to invest your time, like, make it count, right?
Absolutely. And you can make it your own. It's constantly evolving. It's my practice, the way it is now is so different than it was 3 years ago. It's completely different than what it was when I first started. You're always evolving. You always got to be learning. So it's an ever changing game for sure.
What's one lesson you wish you had known earlier in the journey of running a practice?
That I should have a virtual assistant like way early on.
It's so hard to give up control, but it makes a huge difference.
I think that's the one thing is like when you first start, you want to do everything yourself. And it makes sense because you're not making any money yet. But as much, and what I've learned now is like as much as you can delegate, you have to delegate. It takes something off your plate and you got to focus on what you can do best and delegate the other stuff. If you're trying to micromanage and trying to have your hands in everything, that's when you start to get burnt out and you just don't have the energy. You get home, you're exhausted, you don't have energy for your family. So I think it's super important, and I wish I started this earlier to just delegate more and have someone for social marketing, have someone for referrals, things like that instead of trying to do it all myself. I was trying to do my Instagram page and do my blogs and this. So it's nice to have, some help.
Yeah, because
I would have gone more help.
I love that. And then as far as when it comes to other members of the health team, who may be listening to this and thinking, okay, and maybe there's more overlap, when should I say, oh, this is the perfect person, you should go see a podiatrist versus, oh, you need to go see an orthopedic, or maybe it's exactly the same, or are there certain things you say you feel like this is more in your realm or their realm?
I think there's definitely a lot of great fellow trained orthopedics that are foot and ankle trained, and we handle a lot of the same surgeries when it comes to ankle surgeries, Achilles or forefoot surgery. I think as podiatrists, though, we do a lot more kind of dermatology, nail focused type things. So soft tissue lesions. Hey, this is a weird looking mole. I don't know what it is, and it needs to be biopsied. Or like ingrown toenails, fungal toenails, small warts that kids may have. We have a lot more technology in our hands.
And I think the medical stuff, maybe, right? Not just surgical.
Ortho is mostly surgical when it's, like you said, like your plantar fasciitis, things like that are more medical. They need more kind of protocols to get you there. That's when podiatry comes in. We do a lot of diabetic foot care. So a lot of our endocrinologists, a lot of our internal medicine doctors are referring to us for just diabetic checkups, and where we're checking their circulation, we're checking their nerves for diabetic neuropathy, getting them in the proper diabetic shoes to prevent ulcerations, things like that. That's definitely more podiatry. I do a lot of diabetic neuropathy management. So we do nerve biopsies, and I don't know too many orthopedics in my area that do that. Yeah. But a lot of, and neuropathy can happen not just because of diabetes. There can be a lot of our chemo and post-radiation patients have their nerves, kind of those distal nerve endings damaged. So we have a cancer center that sends us patients all the time to get nerve biopsies, because not all nerve damage comes from your back or your neck. A lot of it is just those small endings. So we manage a lot of that. So more medical, less surgical is definitely podiatry, more podiatry related.
And then when it comes to your experience as to what's been effective in making the relationships with referring doctors, like you said, endocrinologists and these other specialties who are looking to have collaborative care of patients, like the oncologist, what have you found has been effective in reaching out to them? Is it, online? Is it like showing up? Is it lunches, talks? Like what has worked for you in your experience?
Most of it has been more meetups. And so initially when I first started the practice, I would go myself and ask to meet the doctor. I think that made a big difference. A lot of times, and later, once you have that established relationship, you can send a marketer just because they already know you. But I think the doctor's getting to know the other doctor and kind of what your kind of core values are, what are your, how you want to treat the patients. I think that makes a big difference. I would go to the hospital where I have privileges at initially when I opened the office, and after surgeries and stuff, just hang out in the physician's lounge and talk to other physicians, vascular surgeons that are, the hospitalists at the hospital, and really kind of build a relationship with them. I think that also made a big difference. And the first time you go, they're not going to send you all these referrals. It takes at least 3 or 4 times that you've gone there, sometimes even longer. And once you start getting referrals, I think it's really huge to send a thank you note back to them, saying, hey, thanks for sending this patient. Here's what we talked about. I think that establishes a really good relationship and that trust between you and that referring doctor, knowing that they're always in the loop. Some of them may not even look at it, but at least they know that they got some things in the patient's chart. But establishing that relationship makes a big difference. And, at least once a year. So a lot of people do Christmas, like they send, I don't know, baskets or something. This I learned from the first employer I worked with. She was like, everybody sends something for Christmas. So we would do something for Thanksgiving. We would get pies for like the staff at the office and the doctor, or like New Year's, like bottle of wine or something. So I thought that was such a good trick, just because it makes you stand out. You're not
one of the 20 gifts on that day.
Yes.
I was like, pies on Thanksgiving. I love that. That's so cute.
Yeah, and the staff likes it. They love to get the little pie they take home for their Thanksgiving meal, and it's the staff is just as important. You can't just be caring about the doctor. It's like going and showing appreciation to the staff. Once we got a relationship with a patient, we would print out our insurances we accept or the conditions we treat, and just kind of keep dropping it at the office every few months, and maybe take them with coffee. Or we would do a cute trick I learned on one of the conferences was M&M prescriptions. So we would have like little empty pill bottles, kind of fill them with M&Ms, take them there. And then every few months be like, hey, we're here for your refill. And just, it's something that's cute.
Yeah.
But it just kind of gets your name and just keeps it fresh, because they're the ones kind of sending the referrals. So, but yeah, I would say that relationship initially should be made between the physician to physician.
I love all of that advice, and I might steal the pie situation.
I love it.
I know, I love it. Lilly, we're so excited to see you at Pinnacle this year, and I can't wait to see you in person. Would love to hear your Pinnacle Pearl. As you know, we end every episode with our guests giving a Pinnacle Pearl to all women in medicine. What would yours be?
I would say don't take no for an answer. There's always a way. If there's a will, it's truly a statement. Reading a book for a while, I was not reading. I was just focusing on work, and, always reestablishing that self-care relationship. Taking care of yourself is so important. You can't be taking care of everybody else around you when your mental health is not in the right place. And the way you you say to yourself, the way you talk to yourself is so important. If you're getting down and you're getting negative, oh, I can't do this, the practice is not surviving, your employees also pick up on that, and it really, and you can see the change. So it's the way you talk to yourself, the books you're reading, the way your kind of mental health is, it makes a huge difference. So take that time for yourself. Be in that positive mental state. And if you are, then everything else kind of always works out. Your employees pick up on it. They're in a good mood. Your patients pick up on the staff's mood. So it all goes full circle, but it all depends on how you're thinking and how you're talking to yourself.
I love that so much. Lilly, it's been an honor to host you here. Please tell us where everybody can find you if they want to follow you online or come to your clinic.
I love it. So my practice is in Carrollton, Texas. I'm a little north of Dallas. You can find us online at carrolltonfeet.com, or I'm on Instagram at dr_Khavari, Khavari. And I would love to see you guys there.
Lilly, thank you so much. It's been great talking to you.
Thank you so much for having me. I'll see you in a few weeks. Appreciate it. Bye.
Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.